Hello and welcome to this edition of FiTV. I'm your host, Brad Swanson. We are coming to you from across the street from Florida's Capitol on the first day of the 2021 Florida legislative session. We are once again joined by our friend, Emmett Reed of the Florida Healthcare Association. Emmett, thanks for coming on.
Brad, it's always a pleasure.
Well, look, your industry has been at the forefront of the conversation of this COVID pandemic. Tell us a little bit, just briefly, about the governor's decision to, keep infected patients in the hospitals versus putting them back in your members' facilities.
Oh yeah, that was a decision that the governor made very early on. He got a lot of heat for that, and it turns out he was exactly right. And we were advocating for the same thing as the Florida Healthcare Association. Sure. In talks with his office. But the governor uses science, and he uses some of the top people in the country to make these decisions. And when he did that, you could see what happened in New York.
Right.
In New York, there were thousands of deaths because they pushed hospital patients into nursing homes. Nursing homes are not designed to care for COVID patients,
Sure.
or at least they weren't.
Right.
Now they can,
of course.
But back then they couldn't. And so the governor did just an outstanding job making a tough decision at a hard time, showed great leadership, and saved thousands of Floridians' lives.
Well, in Florida, dramatically larger, older population,
Yes.
plus a dramatically larger set of, obviously, nursing homes and care facilities. So that was Providence. So let's talk about vaccinations. You guys your members were at the front of the list. How's that going?
It's going fantastic. Again, we can't thank the governor enough for putting nursing homes first, because think about it. This time last year, almost this day last year, in Washington State, we heard the first outbreak of the COVID-19 in a nursing home spread like wildfire. Right? And so we're the most vulnerable population. Most of our residents are 85 years and older.
Right.
And so the governor said, look, the way to stop this is to start with the most vulnerable first and work our way down. And that's exactly what he did. And we're seeing the numbers plummet in nursing homes across the state.
Right. That's just great news. And I think you've seen this governor and previous governors on nursing home issues and caring for elderly population. I mean, this is one thing that Florida elected officials get, and it's due in no small part to your association's advocacy, of course. All right, so let's talk about the legislative session and what's before you this year. Talk to us about your top one or two issues that you guys are focused on.
Sure. Well, funding every year is important, and
Of
the governor
course.
held us harmless in his budget. We hope the House and Senate do the same.
Okay.
We've got COVID liability. That's a hot topic for lots of different professions.
Of course, you're on the front line of treating people.
Correct.
And
we don't want our caregivers looking over their shoulder wondering, oh my gosh, am I going to be pulled and deposed and sued because I took care of a COVID positive patient? I want you to think about this for a moment. At one point, the personal protective equipment, the PPE, was a worldwide shortage. Okay, no one was prepared. A worldwide shortage. Our members were sewing their own masks. They were wearing garbage bags as gowns, and yet they were going in to serve the sickest and the frailest with COVID fearlessly.
Right.
I don't think they should be sued, do you?
No, of course not. But then again, I probably, coming out of my Chamber of Commerce background, have a lower threshold. But I think there's looking out for those who are being responsible to the nth of their ability, and then obviously there's that small percentage that probably are bad actors. But
we're not protecting them. This does not protect them.
Right. And I don't think anyone thinks it is, and I think that's why you've got great leadership in the governor's office, in the House and the Senate.
Right. And then the other, you asked for a couple issues.
Sure.
I'm going to get in. We have a personal care attendant.
Okay.
It's a very, very light staffing bill. What's happened is we have a major workforce crisis in healthcare.
Okay.
Major in nursing homes.
Okay.
And so
We're talking about nurses and doctors, or are we talking about
CNAs, nurses,
Okay.
Administrators, every possible position in nursing homes, but especially on the CNA level. Okay. And so what we've done is we said, look, maybe you're interested in becoming a CNA at a nursing home, but you're not sure. Come and take this 8-hour PCA course where they're training to see if they want to be a CNA.
Right.
And it allows them to do not everything a CNA does, but
Of
it
course
gives
not.
them some allowance to help care for nursing home residents, and that's been a big relief.
It meets some
for
of the
our
demand.
staff.
Right.
It meets some of the demand, but what's really cool is we've already had over 2,000 of these PCAs challenge the CNA test, which means they've taken the CNA test
Right.
because they want to become a professional in long-term care.
So it's a
super
funnel
exciting.
for the workforce.
Fantastic.
That's great. Well, Emmett, we know we're going to stay close to you and what your association's advocating for, because we know typically when you're successful, Florida's elderly population is successful, healthy, and safe,
Yes.
which is what you guys fight for. So thanks
All
for
right.
coming on. We
It's my
appreciate
pleasure.
you. Look forward to having you on soon.
All right, thank you.
That's all the time we have for this episode. Make sure you hit us up for more great interviews like this one on our social media feed. And for now, thanks for tuning in.